Good afternoon, everyone, and thanks to the Institute of Medicine for giving me the opportunity to offer some comments on this particular session. And a quick shout out to all my colleagues from California who got to dredge out all their warmies coming east. I know, they sit in the closet for years and you look for this moment, so it's really great. I want to focus really on four thoughts here and four issues. And the context of the four issues in thinking about communities and states really is, where do we find what I would call the greatest degree of stickiness in the work? Where do we have the greatest opportunity to really grab a hold of some things and have them create a permanence within our communities so that we're really transforming communities for the long run? And simultaneously, how do we do that without leaving anyone behind? I think as we talked about John Powell's comments on universalism, I think we often see some of our work leaving people behind, and that those who are most able to grab a hold of these ideas take them, those that are least able to often are left behind. So in that context, I'm really focusing more on the how of the work in communities and states and less on the what. There's so much good work underway, and sometimes I fear that there is so much good work and it's very fragmented, and that we're not focusing quite enough on the how of the work to really build the kind of momentum that will change the course of this epidemic. So let me first talk about where I think we need to apply some criteria for our actionable opportunities, and this is my first point. I think we need to focus on policy. I think there's lots of programs, there's lots of services, there's lots of stuff, but policy is the most sticky kind of thing that we can do. It is often the most sustainable. It's often, if done correctly, I think has the greatest opportunity to address our equity challenges. Policy is often scalable. So you can do something very locally, and we have seen that in our school nutrition work, which started out as a very local policy effort, and within a fairly short period of time is scaled to national policy. That's true for school meals, menu labeling, water in schools, competitive food regulations. I think that was an enormous success, and it really broadens the impact of what we're trying to do, taking it to a population level that we couldn't really even imagine when we began. The third criteria is these policies have to be enforceable. We have many good policies, but they're completely unenforceable, physical activity being one of them, where we have been challenged for years in trying to enforce physical activity regulations at the local level. And, many people want to resort to litigation because it's the only way we can even imagine enforcing them. They need to be measurable, and these are all criteria that I would propose we look at in thinking through what are actionable items in communities and in states. And finally, and perhaps most importantly, I think we need to identify those opportunities where we can meaningfully engage community. And what I mean by that is really two things. One, it's building power in community, using these ideas to help build that kind of sustainable momentum for change at first the local level and then the state level, where community is really, really involved and leading the effort. And we're providing and creating new leaders who can articulate these issues in their own powerful ways, most relevant to their community. So that's kind of a first how for me, is a criteria for identifying the most powerful opportunities that we have in front of us. I think the second how that I'd like to propose is to adopt a health in all policies approach, a framework that allows us to create a platform for action that engages multiple sectors and ensuring that policymaking supports health. I'm not going to talk much about health in all policies. There's a lot that's been written and spoken about. The APHA just produced a new whole guide on health and all policies, but I think it allows us to be aspirational at the state and local level. I think we can create indicators for success and really engage partners in the way they need to be engaged, because as we've said, many people have said, there's no single solution here. We have to work across sectors. And health and all policies allows us to work, on housing, on land use, on all sorts of things that, from the health perspective, we wouldn't be able to do that alone. I'm going to go really fast. Third, I think we need to protect existing revenue sources and secure new revenue sources. So by protecting our revenue, I'm talking about federal food programs, transportation, the Affordable Care Act, all those programs that we know, but I think we also need to secure new revenue, and whether that's sugar-sweetened beverage taxes or fees, I think those are important efforts and need to be pursued. I think we have opportunities to create new revenue sources in the nature of wellness trusts, using some of our hospital community benefits funds and other funds that allow us to create collective impact by using funds that are coordinated in some more meaningful way. And lastly, I'm speeding along here because I see my red light, we need to leverage some new constituencies. I think we are very, we don't think of ourselves this way, but we're often quite isolated in our own world. And there are many constituencies that care about what we care about, but may talk about it differently. The first big constituency is the healthcare sector, and I'm glad we talked about them, but we really need to leverage the Affordable Care Act in every way possible. And whether that's by the issues around medical homes, around primary care collaboration, and the use of community health outreach workers, that's critical. The sustainable food community, that's an enormous community that cares about food, that cares about good food, and we need to work with them in more meaningful, intentional ways. The community development world, another world of actors and advocates that we need to talk to. The disease groups. I think oftentimes we talk about obesity, but we don't talk about diabetes. Why not? I mean, that's a pathway, and we need to talk about that, and I think people might pay more attention. Climate change, education, these are all sectors that we need to engage more actively if we're going to be successful at the community and the statewide level. And sorry, I went over time.